Start off with your name, your position, and your organization.
Okay. My name is Beverley Wheeler. I'm the director of DC Hunger Solutions.
Okay, so what is the daily, like the day to day of what your job entails?
Well, what we do is end hunger in the nation's capital. So we have a lot of stuff that we do, but we really do it through trying to make sure that the district government makes the highest and best use of federal nutrition programs. So we're taking a close look at what's happening with breakfast, lunch, after school, senior meals, um, early daycare meals. So we're working very hard on those issues. Also, just educating people about how much hunger there is in the District of Columbia, and then taking steps to see what we can do to alleviate it.
Okay, so what are some of the biggest issues that you're currently facing?
I think one of the biggest issues for us may be, in fact, the income disparity in the city. I don't think people understand. They hear that the District of Columbia has a median income of $82,000, and they think, wow, that's great, that's marvelous. But if you take a closer look at the income disparity, it gets pretty hard. And once that happens, there are repercussions for everyone. So it affects housing, the kind of jobs you can get, where you live, where your grocery stores are and are not. And I don't think people understand that.
Yeah, you did mention grocery stores. So how much is a food deserts really affecting low-income communities in the area?
Well, one of the things is we don't like to use food deserts. We like to call lower resourced communities and that sort of thing. But it does have a tremendous effect because if you do not have a grocery store near you, nor do you have a car, nor are you doing work, it becomes very difficult to make sure that you have access to healthy and nutritious food because you have to work so very hard at it.
So outside of the, just expanding the enrollment in the government programs, how much of your work is focused on kind of bringing up those lower income communities or, having businesses begin to develop or bring resources to those areas?
Well, I think by using the federal nutrition programs, we have a tremendous opportunity to help people get out of poverty. So this year, we've done a lot of legislation this year, so we're really excited about that. So we have the Healthy Students Amendment Act, which broadens the ability for students to get breakfast in school. The second thing we've done is the Healthy Parks Act. So that'll help students actually do after-school meals and summer meals. We also have the WIC Expansion Act. And the WIC Expansion Act is actually going to help us get smaller footprint stores in some of these neighborhoods that don't have large grocery stores. And it expands the opportunity for WIC recipients to actually use their benefits in their neighborhood. And we're actually working on the Healthy Shelter Act. And that's going to help many of our residents who find themselves homeless in getting a healthy, nutritious meal. So those are a couple of things that we're working on right now that we really think will raise people up.
Great. Among those, legislative priorities, which one would you say you maybe had the most trouble with this administration, or you had the most success with?
I think the one that we're currently having challenges with is the Healthy Student Amendment Act. Because while the act was passed by the legislative branch, it was not funded by the executive branch. So we get to work on how do we do that funding, and we know that we need to do that. So that's the one that's the most troubling right now.
Okay. So outside of just the kind of policy initiatives, what do you think within the communities, like children and families, what are the biggest issues that you're trying to stress about, like educating them?
Well, I think there's a fallacy in that low-income families don't know what to eat or don't know that sort of thing. What they don't is they don't have access to it. So we try to make sure that we're figuring out ways to improve that access. And it might come in any number of ways. We personally like to see the SNAP benefits increased, and we think that that would help a lot. But when we're not doing that, we're looking at how do we make use of urban agriculture? How do we make sure that residents are able to stretch what they do have? How do we make sure that residents, knowing that SNAP benefits don't last a whole year. How do we make sure that they're not forced to eat shelf-stable foods, which are often processed foods, with only aggravate health issues? So what do we need to do about those things, and how do we use the different partners that we have in order to make that happen?
So yeah, I mean, besides alleviating the poverty in those areas, it's about bringing fresh produce and stuff like that.
Absolutely, and we have a lot of partners to do that. We have our farmers markets. One of the reasons we got involved in the farmers market initiative was because we wanted to make sure they could use SNAP and WIC. We find that residents do, particularly our seniors, love the access to fresh fruits and vegetables. So we're working on that.
Okay, I've read some stuff in the news about having to get farmers markets and stuff like that to be able to accept SNAP cards. Is that an issue here?
During the summer, just for a brief time. But for the most part, for the past 10 years, when we first got involved with farmers markets, I think maybe one market took SNAP. Now all of them take SNAP and WIC. So it's not really an issue for us at this point. There was just a hiccup this summer.
Yeah, I wasn't sure about this area specifically. Right. I've heard a bunch about in Maryland, mostly. So where do you guys see kind of just going forward? Where do you guys see maybe bringing additional programs or policy initiatives in the future?
Well, I'd like to see us do a little bit more with our seniors. We just finished EITC season, which is where we go in and work at the tax centers to enroll low-wage earners and seniors on SNAP. So that season just finished up. And we'll take a look and see how well that did, what was going on there. I think we'll continue to double down on making sure children in the schools are actually being fed, particularly after-school programs. Many of our children have breakfast around 10:30, 11 o'clock in the morning, and that might be the last meal they eat before breakfast the next day. So lunch, they eat lunch at that time. And so we want to make sure that they are eating after-school meals, because they can do that.
Okay. Extending those after-school programs, are those already in place? You're just trying to add more to them?
There are some programs that are in place, but not enough programs are serving a snack or a supper. Okay. So we want to identify what programs are there, make sure that they're actually serving meals, and then if we need to, expanding what programs exist to make sure that people are doing that.
Okay. So yeah, just lastly, kind of take a step back from the stuff that you do and more personally what you do as a director of a nonprofit.
So we like to say that we're small and mighty. And so there's a lot packaged in what we do. There are any number of federal nutrition programs that we have to educate people around. There's a lot of policy, a lot of legislation, a lot of collaboration. We have a lot of partners in this anti-hunger, anti-poverty space, and collaborating with them and working to make sure that people understand. I don't think that people understand that we have an 18% poverty rate in the District of Columbia. That 26% of our children under the age of 18 suffer from poverty. So we get to have that conversation and figure out different ways that all of us get to improve everything for everyone.
And so kind of what is like a day in the life of a nonprofit director? What are some of the daily activities?
I think I start by trying to go through all the emails to see there are a lot, to see what's going on, what are people identifying as needs. The second piece is really resources. Resources are critical in order to do this. We have a shop of 3. So with 3 of us, we've got a lot that we need to do. We do a lot of policy and we do a lot of advocacy. So that requires some funding because some people want to actually fund direct service. Now we do direct service, but the advocacy and the policy piece are critical for everyone, not only DC Hunger Solutions, but a lot of our partners. In order for them to get the funding to do their work, someone needs to be advocating, someone needs to be writing policy.
Okay. So, have you had any experience working in for-profit businesses at all?
I did work for profit, and I've worked for the government. I've worked in a lot of different places.
Okay. Could you elaborate on some of the differences between those kind of business models and how you do your daily activities?
I'm going to say resources,
Okay.
once again, where you have support to do a lot of the things. If I want to report copied, I will be copying the report. If I want to report written, I can work with someone, but eventually I'm going to need to be a part of writing a report. If we want to do outreach, I'm going to have to be out there doing outreach. If we really believe in community engagement, which we do, because that's where we learn what really is necessary. That's where we get to listen to what residents want. And that's the only way a nonprofit works. I think in the business sector, they could decide what they wanted to work on, and they could decide what worked and what didn't work, what was part of their business model, and what they were willing to risk. We don't have that option. If we want to end hunger in the nation's capital, we have got to do it along any number of on the continuum. So we've got to be in everything. I think working with other partners, the collaborations. It's really important that you're out there listening and hearing what your other partners are doing. How can I support them in what they're doing? How can they support me? Continuing the education process. We work a lot with the universities to help the students understand what's going on. And so therefore they come in and they help us. So providing information to individuals so that they know what's going on because they often want to help.
You see, say it's a lot more hands-on and trying to figure out what resources you have and kind of get a smaller connection with them.
Yes, absolutely.
So I guess lastly about those resources, how do you think those compare to one of maybe a national or international nonprofit versus maybe even like a small rural nonprofit? How do you guys compare?
I think that when you're in a bigger nonprofit, there is more things are dispersed. So you have opportunities to reach out to other individuals who are doing things. When you're in a smaller shop, you get to do it all. And I kind of like that hands-on because then you understand how difficult, how easy it is. You're able to make connections because you already know what's going on. So I kind of like a small shop, she says. And I think that it works well for us.
Great. That's all I really had. If there's anything else you feel like you want to elaborate a little more on, you're welcome to.
What we really want people to understand is that hunger is a solvable issue. And that we can all work very hard on it. Lately, I've had an opportunity to speak to international groups about hunger and understanding the difference in the hunger. In many international arenas, there is no food. That's where the hunger comes from. For us, in the United States, it is not that we don't have food. It is that people do not have access to the food. They cannot pay for the food. That is what is so disheartening. But it's solvable, and we can do it, and we will.